Okay, so welcome back to the third of our UQ coronavirus Q&A sessions. You can see that our location has changed a little bit this time. I'm in an office. Ian, you look like you're somewhere in Canada. Is that what we're going for?
Well, for today, that's right. I'm at home along with everybody else.
Yep. Actually, Ian's just a lot more technologically savvy than I am, and he knows how to change the background, whereas I do not. So we're just going to look like we're in very different climates at the moment. So as this pandemic progresses, people are still having lots of questions and sending really lots of great questions into us. So I think we'll just launch right into it. First thing that people are wondering in is about physical distancing. So this question says that new data shows that 8 out of 10 Australians need to stay home to flatten the curve. Can you explain why every single Australian must comply with the physical distancing guidelines?
Thanks, Kirsty. The simple answer to that is that we want to make sure that people do not pass the infection on. And to be honest, we don't know all the people out there in the community who are infected. So everybody has to assume that they are potentially infectious for other people and maintain distance in order to make sure that all the people who are infectious are not passing the virus on to other people.
I think that's really an essential point. And the other thing that is definitely emerging in the scientific literature now is that there is a large number of adults who have an asymptomatic infection. So I was reading a very interesting study about the cruise ship, one of the many cruise ships that's been plagued by this, the Diamond Princess. And there they found about 50% of individuals who were tested positive were actually asymptomatic. So just because you feel okay, it doesn't mean you can go out and have parties or whatever, because you potentially could be an asymptomatic carrier of the virus.
And the interesting thing is that the highest rate of infection now in our community is amongst young people, who are the very people who are, because they feel relatively safe, the ones who are going out and partying. So it's really quite important that everybody adopt a strategy of social distancing to make sure that everybody is protected.
That's exactly right. This is not a policy for some members of the community. This is something that all of us need to be practicing. All right, so along the same lines of physical distancing, people want to know when we will see the effects of Queensland's stricter isolation methods really starting to flatten that curve.
Well, we hope we'll see it very quickly, but of course we don't really know yet. We're still at a very early stage of the epidemic if you compare the figures for Australia with other countries that have had bigger problems. And we certainly don't want to get into the situation that we might have a couple of months to wait, which again is why social distancing is so important. But we have to be realistic about it and say, yes, it might be quite a while before we get to the stage that we see the curve flattening off, maybe a couple of months.
Yeah, and I think, at the moment, the signs to me are really encouraging. We are already seeing an effect of social distancing, but it's very mild, and it's very, very early in the game to sort of let our games down and relax and say, well, we've beaten this thing. Because also this virus has a quite long incubation period. So it's about 2 weeks. So even if you implement something now, you're not going to see the effects immediately. All right, so let's go to the next question. Again, I'm having technical difficulties, which is always the case with me. All right, this is an interesting one because I've had this discussion with a lot of people. And people want to know, what does it mean when we see people are being infected with a bigger dose of this virus?
Yes, it's a good question. I mean, we kind of assume that if you get the virus, you get the virus. But I think it would be fair to say that the bigger the inoculum of any virus you get, the more likely you are to get seriously ill with it. Our bodies have got quite good defenses against viruses, and they can overcome small doses of virus. But if you get a large amount into your airways, it will obviously increase the chance that you get serious lung disease. So I think that the general answer to that is we want to keep away from anybody who's got the virus, but we particularly want to keep away from people who've obviously got runny noses, which might be well charged with the virus.
The caveat I would add to this is that this is not the sole determinant of whether or not you're going to get serious illness. It's such a complex interplay. But the point is that probably it really relates back to healthcare workers, and that they're at greater risk of infection because they're doing these procedures that are generating infectious virus from individuals who are quite sick and therefore probably shedding a lot of virus. All right. Okay, sorry. This is a challenge with Zoom. I think we're all learning how to use Zoom this week. Okay, so this is something that's been reported in the media a lot, and I think it's really important to get the science here clarified for everyone. How does the point of care finger prick test work, and is it effective?
Well, the point of care finger prick test is very different from the test that we've been routinely using to find who are infected with the virus. The routine test looks for the genetic information of the virus. This finger prick test looks for something in the blood, antibody against the virus, to see whether you've had the virus already. We know two things about it. One is it will not be as quickly positive in the course of an infection as the test for virus itself will be, simply because it takes time for our body to generate an immune response. And secondly, it will not discriminate well, I suspect, between people who are currently infected with the virus and infectious for others, and people who have had the virus in the past and may now have some degree of immunity. There is a trick to the test which tries to look to see if there is a new immune response going on to the virus, but these tests are very much more difficult to calibrate than the virus test that we currently use, where it's positive or it's not. This is a test where basically there's a grey scale in the middle and we're really not sure. So it's a good screening test. It may be very useful down the track to identify who's been infected already and therefore might well be immune. But as a quick test to find out if somebody's illness at the moment is due to the virus, it's probably not going to be as accurate as the test that we use when we sample from inside the nose of the mouth.
So now, instead of adding to that answer, I'm just going to ask a question because I'm privy to this. I'm just wondering if there is any data out there about the sensitivity of these finger prick tests and their specificity. So how specific are they, and how much they're measuring antibody levels in the blood, and how much antibody do you need?
Well, this is something which is still being researched at the practical level. We don't know the answer to that question yet. We do know that people who are in the later stages of the illness, usually, i.e. 90% get positive blood tests. But beyond that, we're still learning. And I think that one of the reasons we will continue to do research in this area is to find out how reliable that test will be.
Yeah, and I think this is going to become really important as this pandemic progresses. So it's good to have that insight. Thank you for letting me ask my own question. Okay, so moving on to the next question. No, this is a very interesting one. As our immune systems become less naive to the virus, do you predict that symptoms will be less severe next year?
Well, it's interesting that we've already seen that this virus is changing genetically as it moves through the community. Indeed, there was a paper referred to in the papers this morning saying that they now have at least 8 different mutated strains of the virus. These ones are not yet different enough from the original virus that they're going to cause a different disease. But it's quite possible that the virus will induce an immune response, or it's possible that the virus will change and therefore we will not be protected by the immune responses we've already got. We have once again to do research to find the answer. But the short answer to the question would be, if we generate protective immunity, then yes, the second time we see the virus, we'll either not be sick at all, or if we do pick up the virus, we probably won't get as expensive an illness.
Yeah, so it's interesting you mentioned that paper about the different strains, because as a flu virologist, flu mutates much more than this virus. Okay, so this virus, even though it can change, flu is really much more impressive. And you know, I look at that data and I think, well, it's actually kind of positive news because it is changing, but it's changing pretty slowly, at least in my opinion, relative back to the virus that I know better.
Yeah, I think the nice thing would be if it changed to a form that was less virulent. Coronaviruses traditionally mutate towards less virulence in humans as they pass through successive humans. So with a bit of luck, any mutations that survive will be the mutations which actually don't kill hosts, and in fact are just producing minor symptoms.
Well, let's watch and wait, I guess. That's what we have to do. All right. This is also something that's been in the news lately a lot. Can recovered COVID-19 patients be useful as blood donors, specifically white blood cells, for those currently fighting the virus?
Well, for the white cells, it's relatively easy to answer that question because our own white cells only work in us by and large. We're genetically sufficiently different from each other, and particularly in our immune system, that our immune system doesn't see other person's white cells except it has targets to be shot at. And they will quite happily, the body will quite happily eliminate those white cells because they're non-self, in much the same way as we generally would reject an organ from a randomly selected donor. That probably isn't going to be particularly useful. I think it's much more interesting to think about the possibility that serum from somebody who's already been infected and recovered might be useful for controlling the virus. Most of the virus is in the lungs, it's not in the blood, but the stuff that we put into the blood may well spread into the lungs and help to mop up virus.
Yeah, and there's some actually positive sort of clinical studies coming out in regards to that, this idea of maybe we can purify the antibodies from individuals who've recovered from the disease and give them to individuals who have severe forms of the disease. And this is something that's really being actively investigated actually worldwide.
The nice thing is that if it works, it is a very good indication that we could also make in the laboratory an antibody which would do the same job.
That's exactly right. And we wouldn't just be depending on the serum from recovered patients. All right. This is a really important question. Most important question because I'm a dog lover. So can I give my dog or cat coronavirus, or could they give it to me?
Well, from what I have read, and there is not much in the literature yet, it's clear that cats and dogs have been infected with the virus. It seems to be a pretty rare event, fortunately, but it does seem to be possible. I suspect that the virus will probably not be spread the other way around. Usually when a virus moves into a new host, it becomes very much more virulent there or dies out. And since nobody has yet presented a cat or a dog which has passed the virus on to other cats or dogs, I think it's quite likely that it's a one-way trip. And if it gets into your dog, it probably won't do very much and it won't get passed on to other animals.
Yeah, I mean, this is something I've been following a lot because I have a dog and I'm always concerned about her. And the literature I've only seen 2 cases of dogs being infected, neither of which was symptomatic, but one did develop an antibody response, which is interesting. And then recently, I mean, take it with a grain of salt because I was reading it in quite trashy European news. There was apparently a cat that developed signs of COVID in Belgium. Okay, so I'm liking that you also heard about this. But again, I agree with you. I think these are very rare events and it's very unlikely to go back the other way.
So the short answer is keep your cat and dog. They're good companions. And
yes,
we need them while you're isolated, but don't worry about passing the virus on to them and don't worry about them passing the virus back to you.
That's exactly right. So I think on that positive note, that's the end of our questions for today. We are probably going on a little bit of a break for the next few weeks, and that's just to give us a chance to actually focus on our coronavirus research, because aside from doing this, we are also active researchers. But we hope that this has been very informative for people, and we will come back, and so keep sending your questions in. Ian, do you have any final words for people about what's the situation?
Well, it's still the same message. Keep calm, carry on, follow the rules. Social distancing will allow us to get control of this. And in the meanwhile, the research is going on in the background, which will help us to control the problem. And I just want to thank Kirsty for being such an excellent inquisitor, I think would be the right word. And really enjoyed providing this information for you. We hope that you all stay well, follow the advice, and we'll be back in a little while to talk further if we need to.
All right, so everyone stay safe, stay healthy, and we will hopefully see you soon. Thank you very much.